Hey everyone, and welcome to my YouTube channel. If you already haven't, please hit the subscribe button. It would literally mean the world to me. And hit that notification bell also so you can be alerted every time I upload a new video. Without further ado, this is the last part of my acupuncture cupping series of videos that I will be posting for a while. This video is going over how I felt the day after, how well chiropractic worked in conjunction with acupuncture and cupping. It also shows you what my back and neck look like after the acupuncture treatment a day later. And I do report that I am in pain, but I did not update the end of the video. The following day afterwards, I felt so much better. I have not had relief in that one spot that I was telling that I have never, it's always been in pain and always there. It was adjusted very easily and moved into place for the first time ever. And I was absolutely amazed by that, and I had relief for a good amount of time after that. Yeah, the first day afterwards hurt and felt like I had a crazy workout at the gym, but just like the gym, that feeling, that achy feeling goes away, and then you feel a lot better. So I hope that you guys enjoyed this series, and I hope that you guys learned something, more importantly, because I think most of the time doctors and stuff just point you to other Western medicine and go to pain medicine and go to that kind of stuff, go to the pain clinic, before exploring these type of options. And I think a lot of people with disabilities don't realize that these options can work for them. So I am trying to show you that these options have worked for me personally. Does it get rid of my pain 100%? No, it doesn't. But it does take it down a considerable amount for me to be able to function every day. So every little bit counts when you are living with a disability. And I hope that you guys will explore all the options available to you. If you guys have any questions, feel free to ask, and I'll do my best to answer them in the comments section. I also can direct Kate to answer any questions that you guys may have too about cupping and acupuncture, and perhaps the chiropractor, who happens to be my brother, to also answer some questions if you guys have any below. We're all here to help, and we just want, more importantly, to see you guys feel a lot better if you are living in chronic pain of any sort. So I hope you guys enjoy this video, and until next time, I will see you then.
So today is the day after my acupuncture treatment that we documented, and she definitely showed a lot. And I'm going to go ahead and say that I am very sore today. I woke up in a lot of pain, but it's raining really bad and the weather is kind of contributing, I know, to a little bit. But the pain I'm feeling is literally like I just got done working out at the gym, and you wake up the next day like sore from like all the work you did at the gym. That's what it feels like. It's not like some kind of unbearable pain, you know what I mean? It's like a good, you know that you did good, and it's probably good that you're feeling that pain. I'm going to venture to guess, like she said, it's like the lactic acid or whatever leaving your muscles, and similar to working out. So it's hurting really bad in a spot that I'm always in pain at. So I'm kind of excited to see how it turns out, because if it just stops hurting like the next day or two, or I get relief, I'm gonna be super pumped, because that spot is always so painful to me. So I'm willing to put up with some discomfort the next day, because that's all I can really describe it as, is discomfort. I'd rather put up with a little bit of discomfort and have the results of having some relief for the first time in a long time.
So here's your back after the cupping treatment yesterday. Shadow there. Well, yeah, it looks like the upper trapezius has been going a little bit nuts there.
Which has been the issue.
A lot of basically the lactic acid buildup and other things that go along with it. And that builds up too much, the muscle can't function properly. So that doesn't drain out. I'm Dr. Jason Zablotny. I'm a chiropractor and a chiropractic neurologist. And I also happen to be Miss Wheelchair Pennsylvania 2018's brother.
So, what do you think chiropractic care can do for someone with an injury like mine?
Well, for a spinal cord injury or other major, injury to the nervous system, the main purpose of chiropractic is to improve and maximize and make more efficient the functions of the nervous system, whatever state the body's in. By focusing on the structure and what structure you have that still, is in good repair, is still functioning, we can make sure your nervous system can do the best that it can.
A lot of people ask me, can you still see a chiropractor because I have hardware in my back, as do I. Can you say how you work around that hardware and maybe any concerns someone has and what's going on about that?
Absolutely. As a chiropractor, we consider the spine as one entire structure from top to bottom, head to sacrum, even head to toe. So if a certain area is surgically fixated, like with, whether it's cadaver bone or, like you have rods in your back and pins and everything, keeping everything together, or even some severe scoliosis cases that are, solidified from the entire thoracic cage, we can still work with that. You still have the rest of the nervous system that still has to move and adapt around that, especially considering that oftentimes when the spine is surgically fixated like that, the areas above and below that fixation are suddenly under a great deal more stress and having to compensate for that area not moving anymore. So we can still work with those areas and be sure that the rest of your spine is experiencing less stress, and can hold itself even with the areas that are fixated.
Now, if anyone with my issue, in particular, a similar issue, does have a lot of hardware and they're still nervous about you touching their back, what else are you able to adjust and work with to maybe relieve some kind of pains that they may have that they may not realize are stemming from something else?
We can still also do a lot of extremity work, arms and shoulders and knees or hips or whatever works as well. Ribs as well. That's something a lot of people do not consider, that the ribs do move and are very easily misaligned, actually. And you have 24 ribs, 12 on each side. Some people have extra. But and even just the most innocuous of movements, you twist and you lift something and there you go, you get a little bit of a muscle spasm, it pulls on a rib and it stays out. Suddenly you have a hard time breathing because now that rib doesn't follow your lungs, it fights against it. And I've seen a lot of people with and without disabilities with rib issues that as soon as it's adjusted, that they feel like a new person. They can breathe again. Suddenly they get blood flow to their head like they were missing because the rib wasn't allowing the chest to expand appropriately, so the heart couldn't pump properly.
Now, someone with a disability like mine who's in a manual chair, would you like to say how the ribs are under more constraint and everything, and how your ribs might be going out more often than not?
Well, yeah, someone with your particular situation, yeah, I would say your ribs are definitely under more strain just because you're twisting and moving and doing a lot more things with your upper body than most people do on a day-to-day basis. And further, you have basically half of your spine is also surgically fixated. So those vertebrae aren't moving, but those ribs attached to those vertebrae still are. So like I said, those areas above and below a spinal fixation, a surgical fixation like that, experience more stress. Those ribs also experience more stress as well because now they're moving against something that isn't.
I went and saw Kate Frame yesterday to get cupping and acupuncture done. Would you like to say your original thoughts on acupuncture and cupping, and then now what you've learned and how it works for chiropractic care?
I did not know much about cupping going into your first visits with Kate, but she's very professional, explained the whole thing, and it actually makes a lot of sense with how the muscles, as they work and are overworked, essentially, collect all that lactic acid and other metabolites and don't drain them properly, and that the cupping helps draw those out. And once drawn out, your body gets to flush those through, and the muscle works more appropriately. Acupuncture, I was actually introduced to acupuncture a little bit while I was in chiropractic college over a decade ago. I took some courses from a doctor in town on applied kinesiology. And acupuncture meridian work is actually one of the five cornerstones, essentially, of applied kinesiology. So we did work with it a little bit, not with using any needles or anything, but just with understanding how the meridian system works and runs. And I have to say, it actually it makes a lot of sense with the chiropractic philosophy. With chiropractic, we're not necessarily treating a particular condition or particular set of conditions. It's not like someone comes in with a headache and we know we have to adjust C5 from the right, to fix that headache. That's not how it works. With whatever anyone has, whether it's headaches, sinus conditions, or spinal cord injury, we analyze the nervous system and the structure of the spine, see what's working, see what isn't, and what we can get working better so that the whole system works more efficiently. And that whatever your issue is, your body's able to heal and deal with it better. Acupuncture is very similar. It's not like, you go to your acupuncturist, you say, my knee hurts, and they put needles in A, B, and C, and, your knee gets better. They're supposed to analyze how the meridian system works and, how that flows. And the initial explanations we got, in class made it seem, not well understood and kind of mystical even. But I think Kate, she's had the full education on it.
Yeah, she went over it all.
Yeah, and it makes much more sense dealing with connective tissue and blood capillary, capillary flow, and again how the muscles hold on to metabolites, and that the insertion of the needle basically allows a little bit of a sympathetic parasympathetic reaction going on that lets the capillaries basically open up and drain things out of the connective tissue. At least that's how I understood her explanation.
Yeah, that was pretty similar to what she said. Now, when it came to my case, what made you pretty much say, go try acupuncture, whatever, you have nothing, let's just go? What made you just kind of just do it?
One of the things I remember being discussed in class, again, those many years ago, was that a lot of joint issues respond to atmospheric pressures quite a bit. So as a storm front comes through, or cold front or whatever, and and just that change in pressure can expand or contract a joint and just make it more irritated. So everyone who has arthritis, or especially you've got a lot of hardware in your back and a lot of arthritic growth going on, that aggravates it. And you're just absolutely miserable anytime we have a storm coming through, which Western Pennsylvania, that's like
daily.
10 months out of the year at least, right? So when we heard of Kate and that she was local and
semi-local,
I figured it was worth a try.
Now, since I've been getting acupuncture done as my chiropractor, what have you noticed as the significant changes with the acupuncture first, but then she eased into the cupping, and what you've noticed since then with treating me and my life in general, just being my brother and dealing with me?
Like I mentioned about that atmospheric pressure, and you being so reactive to it, that tends to respond very well to acupuncture. Normalizing that energy system within the body, it helps that deal a little better. I think you've done better with that. There have been some days where a big nasty storm was coming through. You didn't react as much as you used to, let's say. I mean, I know for a time you could basically predict when a tornado was within the Tri-County area by how bad your back felt. And you were right. It's like, I think there's tornadoes happening somewhere. Like, you're nuts. 6 o'clock news. Oh, yeah.
There's a tornado.
Yeah, there was a tornado in Indiana County. Oh, boy. She wasn't kidding. But the other thing was, you had a startle reaction. Like if you lost your balance while transferring in or out of the car, and, you had to suddenly, basically brace yourself, grab onto something, or you twisted your neck real quickly, those muscles would seize up. Like they were so much tension and such high threshold within those muscles that they'd contract and not let go. So they were pulling your ribs out left and right, pulling your neck out and getting you stuck that you couldn't move your head. I think both you and I noticed almost right away that reaction started to decrease. Like as those things started to get pulled out of the muscles and they started to relax and release, you didn't have that startle reaction. Or even when you did have a startle reaction, because you'd still lose balance or whatever, it wasn't so severe.
Did you notice anything else with, like, when you touch me, or I'm not as sensitive, or?
Yes. Used to be, well, you're still fairly sensitive, but it used to be extremely sensitive. Like even just laying a hand on your shoulder you'd say like you felt like you got punched.
And same with when you're adjusting me too. Do you notice anything different in my reactions and how I'm handling the adjustments?
Yeah, well, today we don't have it on video, but we did adjust you before doing this little interview. And you actually adjusted very well for like the first time since
ever
your injury. Yeah.
We were kind of wondering.
Yeah, it's like, wow, so this is really working here. But I think part of that was just that you were so sensitive that as I had to put pressure on the bones to move them, and I'm using as little pressure as possible still, you'd still tighten up. You'd have an understandable reaction. Someone's been pushing on your back, it's uncomfortable. Yeah, you're gonna tighten up a little bit, and it just made moving the bones much more difficult because your muscles are very
tight,
and very very trained to keep stable.
What is your overall opinion now with what cupping and acupuncture has done for me personally, and how it is for everyone else and all your patients and anyone that you come across?
Very positive.
Would you definitely recommend it to everyone?
I would.
Now,
I kind of wish she was closer.
Would you like to add anything else about chiropractic care for people with disabilities, and how different chiropractors can accommodate and work with you, and maybe different techniques to look for, different types of chiropractors to look for when they're looking in their areas for someone who might be better with a technique that works for them? Because there are different techniques.
Oh yeah, there's 200 different ways to do this job. You definitely want to go to someone who either will take their own x-rays or will analyze all the imaging you've had done and maybe send you for new imaging if they need. For such an involved case, you need to know the ins and outs all the way around. So a very careful examination, thorough. That's going to be key. A couple techniques that I feel would be most advantageous. Anyone who practices with the chiropractic neurology certification from the Diplomate of the American Chiropractic Neurology Board, DACNB. They're going to have very specialized exams that could really key into different areas of your nervous system that are working, or if some area isn't working, maybe find a part of your brain or spinal cord that has a little bit of function that you can use that to sort of bring that other area up a little bit. It's amazing the interactions that my colleagues with that certification can come up with. Also, specific upper cervical techniques. Ones that come to mind would be Blair upper cervical. I practice Blair. A technique called NUCCA, N-U-C-C-A. It stands for National Upper Cervical Chiropractic Association. Orthospinology, Atlas orthogonal, and even some knee chest specific chiropractors. I did see a video recently of a doctor who practices knee chest. And the peculiar thing about knee chest is you have to get in a position that, someone who uses a wheelchair would find very difficult to get into. You basically have to be kind of on all fours sort of situation with your head turned to one side. And the doctor contacts basically just underneath the skull and makes the adjustment there. A little difficult to get into that position, but this doctor did make an accommodation in his office where he was able to basically set up a table on a door, so that all the patient had to do was basically wheel right next to the door and have his head right against the pad there, and the doctor was able to adjust sitting up. So I thought that was
that's pretty accommodating.
That was really interesting there.
Now, do you think that they should call and ask if they've had experience with people with their particular disability or injury, or do you think that most doctors can handle it regardless?
I think as long as they're well informed, most doctors can handle it regardless.
Okay.
Like I said, they be thorough so that they take all your imaging and all your medical history. Let them know what exactly what your situation is. They'll know what they can and cannot.
We all know about those chiropractor horror stories. You constantly hear people whine about that. I heard Uncle Fester got a broken back. Now, so obviously when someone has a broken back already, they might be a little bit scared. Now, do you want to address anything when it comes to the hearsay stories that probably are far and few between, and maybe certain certifications will say that will never happen?
Not to minimize the unfavorable experiences some people have had, because they are out there, but they do often get repeated more than successes, and kind of blown out of proportion at times. And I think if you dig into the cases, the few that have been published in the literature, you find out it comes to a case where the doctor was not thorough. They did not do a proper examination. I'm reminded of a case of a couple years ago where a young lady, famous model actually, did experience a vertebral artery dissection. And unfortunately, the way the case went, the chiropractor wound up being blamed for it. I don't know that that was necessarily fair on his case, that the chiropractic adjustment caused the vertebral artery dissection, because, as the patient described it, she had a photo shoot where she was in a rather strange position, I guess, with the neck for a long period of time, and felt kind of funny after that, and that's why she went to the chiropractor. That's much more likely where the dissection occurred and started. Where the chiropractor was at fault was he did not do a proper exam to determine that's what was going on. And so he missed it. It was a case of misdiagnosis, not technique trouble.
And you have sent people, after you did diagnostic testing, out the door to go to the ER in the past, have you not?
Absolutely. That's the result of being thorough. You do the right job.
Because if you do not have an x-ray, how do you see what's going on 100%? Because didn't you say some people come in with actually broken backs and they don't even know it?
Mm-hmm.
They just think it's out of line. So, yeah, being thorough is key with everything you do. And one more thing about the cupping. Now, all the marks that they saw that you recorded earlier. Now, did those marks tell you something on, while you were looking at my stuff and what to adjust and what to focus on and what was the problem area more so than, elsewhere? That kind of gave you more hint to go.
Yeah, they kind of speak to me a little bit. They may not speak to me as much as they would Kate, because she's trained in that work. But it does tell me, basically gives me an idea of which muscles have been, so tight and pulling and just, filling full of metabolites and all that kind of junk there for a long period of time. I guess kind of gives me an idea as to how chronic of a state that muscle is in.
Because of the cupping, do you feel that that definitely was a contributing factor to the best adjustment we've ever had?
I would agree. Yeah, I practice in my own office in Windber Chiropractic Clinic. We see all manner of cases. Take X-rays on site. Been in practice 12 years. We have actually 2 doctors on staff, myself and Dr. Simone Fleesick. She's also a graduate of Palmer College. Also practices Blair upper cervical specific. In fact, to my knowledge, her being here makes us the only office in Pennsylvania that has 2 doctors practicing Blair upper cervical.
With that being said, you guys were able to get a little bit more information as to different alternative medicines that I personally go and use and utilize as a means of coping with my pain and the different issues I experience with my body, being an active wheelchair user. So I hope this helped you guys out, and I will see you next time.